Sundowning is one of the most challenging behaviors that caregivers face when working with patients who have dementia. This refers to increased confusion, agitation, or restlessness that often begins in the late afternoon or evening. For caregivers in adult family homes or home care settings, this can become a daily struggle, but with the right strategies, sundowning can be managed and reduced. Sundowning happens for several reasons. As daylight fades, the brain of somebody with dementia can become overstimulated or confused about the time of day. Fatigue, low lighting, hunger, pain, or changes in routine can all make symptoms worse. Some patients may pace, yell, refuse care, or become fearful. Understanding that these behaviors are not intentional but a sign of distress helps caregivers respond with patience and calmness. The first step in managing sundowning is to create consistency. Stick to regular routines for meals, medication, rest, and bedtime. Predictability helps patients feel safe and reduces anxiety. Try to keep evenings calm. Dim the lights gradually instead of turning them all off suddenly. Lower the background noise. Avoid too much stimulation like loud TV or busy conversations. Environment makes a big difference. Make sure that the rooms are well lit as the sun goes down. Shadows or dim corners can cause confusion or fear. Close the curtains before it gets dark to reduce reflections that might look like people or movement. A soft lamp, gentle music, or a quiet activity like folding towels can help soothe and distract. Physical needs should always be checked first. Is the patient hungry, thirsty, in pain, too warm or too cold? Unmet needs often show up as agitation or restlessness. Offer a light snack, water, or a bathroom break before symptoms usually begin. Early evening is also a good time to provide comfort items like a blanket, familiar music, or a favorite activity. Avoid overstimulation late in the day. Limit caffeine, large meals, and naps that are too long or too late. Gentle activity during the day, like short walks or chair exercises, can help reduce evening energy and promote better sleep at night. Stay calm and reassuring. When sundowning starts, keep your tone soft and steady. Avoid arguing, correcting, or telling the patient that they're wrong. Instead, redirect them gently. Try saying, "Let's sit down together," or "Would you like to help me with this?" Sometimes sitting beside them quietly works better than words. Observation is key. Track when sundowning usually begins and what seems to trigger it. Write down patterns. Is it always after dinner, around a certain time, after a noisy activity? Once you identify the triggers, you can plan ahead to reduce them. Finally, take care of yourself as a caregiver. Sundowning can be emotionally draining, especially when it happens every day. Remember that it's not your fault and it's not the patient's fault. The brain changes caused by dementia are what drive these behaviors. Using calm routines, gentle communication, and a structured environment can make the evening smoother for everyone. Sundowning doesn't disappear overnight, but with consistency and compassion, it becomes manageable. Every patient is different, but your patient's observation and care make a huge difference in keeping them safe and comforted as the day winds down.